Good afternoon, everybody, and thanks very much for finding the time to join us at our annual general meeting. Working better together has been the bedrock of our approach to the planning and delivery of services during the past year. Building on existing relationships and developing new collaborative approaches has enabled us and our system partners to think differently about how we collectively use our respective skills, assets, and resources to drive change and improve services in the communities we serve. We've refreshed our strategy, and this sets out our ambitions for a future where everybody working in health and social care will work together around a shared vision to create a healthier local population. We've called our refreshed 3-year strategy Communities Matter, to emphasise the central role that communities play in shaping our response to the health and wellbeing challenges that we all face. Delivery of the strategy will come through our day-to-day delivery of service as business as usual, but a key cornerstone of this work will be how we engage with the communities that we're responsible for serving.
The resilience of our staff continues to be tested by the extraordinary pressures within many of our frontline services. This year, as in the past, we have seen an increasing demand for the services we provide and calls for additional support from our colleagues in our local hospitals. At the same time, there have been personal challenges posed by cost of living increases which impact on all our lives. It is testament to the skills, knowledge and professionalism of our nursing, therapy, dental, doctor and corporate colleagues that we have continued to provide essential support to all those in our communities who require our services.
As we know, significant media attention has been given to the pressures felt by health and social care providers during winter, with many staff, including Bridgewater colleagues, having worked in the NHS for a considerable number of years, managing levels of demand and complexity that they've never previously had to experience. At the front and centre of our response was a commitment to providing patients with excellent care in community settings and preventing unnecessary hospital admissions, keeping people safe at home, independent with their families and loved ones. During 22-23, integrated care systems were formally established across the country to enable greater collaboration between those organisations working in health and social care in that system. In Cheshire and Mersey, we have the Cheshire and Mersey Integrated Care System, led by the Integrated Care Board, bringing together public services, including those of us working in the NHS, GPs, local authorities, and the voluntary and community sectors. Within that system, we've also established a collaborative of organisations that provide community services and/or mental health services across Cheshire and Mersey. The intention of which is to bring the very best of what we do across the 9 places in Cheshire and Mersey and ensure that that benefits all of our services, staff and patients working in those places. Colleagues across our organisation already work alongside their colleagues in hospitals, councils, voluntary and third sector organisations, and we each bring with us a knowledge of the communities and places we serve.
As the Foundation Trust, our Council of Governors is an important part of our constitution, and we would like to pay tribute to 2 of our long-standing governors who sadly passed away this year. Mrs. Diane McCormick and Mr. Paul Mendacre were instrumental in engaging with our wider community, and during their time of service were committed members of our council. They are both greatly missed. When we think about where and how we fit into our local health economies, we are always drawn to how privileged we are. We do not sit outside of people's lives. We are part of their everyday, and we are extremely proud to be so. The opportunity to present our annual report is a unique occasion to showcase some of the remarkable work that goes on within the Trust every day. In deference to our ambitions to improve our green credentials, this year's report is available online via our Trust website. Behind our fantastic clinical teams are many highly skilled NHS professionals who provide expert help, support and guidance and give our teams the headspace to do what they do so well. Mr. Nick Gallagher, our Executive Director of Finance, will highlight just some of the work that goes on behind the scenes to ensure that we continue to meet our statutory responsibilities. We are indebted to all our staff for the extraordinary work they do day in and day out. It is truly a privilege to serve as your chair. Nick, it's now over to you.
As ever, it's up to the finance guy to provide assurance of continued diligence in meeting our statutory financial responsibilities. This isn't just the job of my fantastic colleagues in the finance team. It is a reflection of the great culture within Bridgwater, that of working together and supporting each other. Maintaining a healthy cash balance, securing unqualified approval of our accounts for last year, and exceeding the Better Payment Practice Code. These are no mean achievements. We are one of the few trusts who can boast about these incredible accomplishments in 2022-23. I am extremely proud of the work done within our workforce team in developing a hugely attractive, rewarding and successful apprenticeship scheme. Drawing on the knowledge, skills and experience within our local communities makes sense any day of the week. Last year we launched our green strategy, and today we're driving cleaner, more efficient vehicles. We are actively replacing the old gas-guzzling boilers in our health centres and clinics, and our printing, such as it is done on recycled paper. Our ambition in 2023-24 is to continue to deliver fantastic services and achieve a break-even financial position. The message that threads its way throughout our Communities Matter strategy is simple. Invest in community. Invest in our staff and our services. There are many thousands of people who benefit from the work we do day in and day out. As an executive team, we thank you, our Team Bridgwater people, for your tireless efforts in supporting people to live in their own homes and lead independent lives.